My name is Jackie. I'm a doctor of physical therapy. I have been practicing physical therapy for 5 years now, and I chose to become a physical therapist because I just love helping people move better. So I do a lot of movement assessments and just kind of break down some of those smaller movements. We look at a lot more of those functional movements and break each one of those movements down and kind of look at the muscle. How is the muscle functioning? How is the joint functioning? And being able to combine those together to create a much more functional and efficient movement. On top of that, we also do some injury prevention training. So, if for some reason you're worried about something that you're like, I just don't feel like I'm moving exactly right, let's talk about how that movement is working so that we can prevent an injury from occurring before it even starts. On the flip side of things, we also look at things after the injury has occurred. So whether that's something that's acute or whether it's something that's chronic and it's been lasting for forever, it's really great to be able to kind of work with people where they're at. The human body is designed to move. Aside from that injury prevention and kind of like looking at that, sometimes it's about dry needling. Dry needling is a great treatment option. It's designed to go in and target those kind of sticky points or those super painful points. One of the biggest ones that I typically treat with dry needling is like that shoulder kind of like neck area where it's like you're like, I feel like I'm up here all the time, but I'd like to be down here. Another option that's a little less aggressive would be cupping. The thought process behind that is that we're trying to increase blood flow, decrease tissue tension, and just help people to move a little bit better. I do a lot more kind of like functional movement with my cups because I can have people lay there, but physical therapy is all about movement. So why not have a little bit of that deep tissue kind of work in addition to some movement at the same time and kind of facilitate that. When you book that through house call, I would say you would want like a movement assessment, which is kind of like our initial evaluation. What we're looking for at that point is we're trying to kind of figure out, is it just the riding that's kind of done you in and you just need a little bit of soft tissue work? Or do we need the soft tissue work? And then in conjunction with that, let's kind of work on developing some of that strength just a little bit more. Because riding is great, but a lot of times what we see in our riders, especially when we're looking more at kind of like that upper body, is that we don't have as much of that like muscle activation from the upper back muscles. So we want to spend a lot of time kind of like working on that strengthening. So what we'll do is we'll try to give you a few things that you can kind of start working on, and then we'll kind of set that up via like an online platform. So that way you can continue to go through and have some exercises and some kind of programming that you can continue to do, whether that's independently or whether that's, you want to have someone there to make sure that you're doing things correctly. Because one of the things that I love about physical therapy is it's not just that like soft tissue kind of like hurt so good, feel good kind of thing. It's also about making sure that our tissues are able to continue to do the things that we ask them to do. So, and strengthening things up from there. So, and that's one of those things that it's like we kind of work together to decide what you need. You may just need that one session, or if you're like, no, I just really want to understand more about my body, how I want it to, and I want it to move better. Great, let's talk about that and let's come up with a plan together, because your goals are super important and we want to make sure that you're on, riding at the top of your game. So I think one of the beautiful things about what I do and what I have to offer is that traditionally, we view physical therapy as like, okay, I have to go 2 to 3 times a week. I had this injury. Doc is telling me that I have to do that. Well, a lot of times, though, I do genuinely believe that if we can continue to promote some of that independence with our clients, traditional PT does not have to be the way that we need to go. I kind of enjoy the concept of a hybrid model. So I come in, I do the movement assessment, and then you still have access to me throughout, but we're using like a really nice platform that you have access to me, you have access to your programming. And then if you have questions, it's something that it's like, feel free, you can shoot me a quick message on there and I can respond back to you. It's not like you have to wait days and days before you see your provider to have your question answered. That's one of the things that I definitely love about getting to work with my clients is I want them to ask questions. I want them to understand more about what is going on with their body. And so the nice part about that hybrid model is that it opens up the floor for you to be able to ask those questions and not feel like, oh my gosh, like I can't ask that question. I have to wait until I actually see my therapist. So, and I kind of want to definitely break down those barriers to that care, so that way everybody's just a little bit more independent and you're kind of taking ownership of your health and wellness, because at the end of the day, it's your body. So you should be able to have the most control as far as how you're progressing. You just may need a little extra help.